While we are a full-service adult-based practice, our passion lies at the intersection between optimal aesthetics and restorative function.
The biggest part of our practice is non-surgical treatment of TMJ, award-winning aesthetics. We do comprehensive aesthetics, and the Plateau Bridge, which we're very excited about.
If a patient has been dealing with TMJ issues for a number of years, with losing teeth, dysfunctional bite, they're not going to be able to really enjoy, first of all, smiling, because they probably have worn down their bite. They probably don't enjoy their smile. They're probably not happy with the way that they look, but also with chewing food, with holidays, with going out to dinner. They're not going to be really enjoying that if they're in constant pain. So what we're doing is trying to restore these patients to a healthy, happy, functional bite and also to a beautiful smile. All of the work involved with our patients is done under one roof. Both of our doctors deal with both the restorative and the aesthetics function, so everything is done here. So our patients aren't dealing with shuffling between different doctors' offices, whatnot. Everything's done in a controlled and timely fashion, and as far as follow-up care, we deal with everything here. You're not going to be seeing someone else if you have a problem with something. We keep everything here. We take care of our patients.
Fear is one of the primary reasons that people delay necessary care. They end up needing more extensive work. Sedation dentistry allows us to get them to a point where they're totally relaxed, they're calm, and they're not feeling the experience that they're under. We've had patients, we've been in 3, 4, 5-hour appointments, and basically the patient is sleeping through the appointment. Not that they're unconscious, but they're just so relaxed that they'll just fall into a nice light sleep, and we maintain everything, and it's just a wonderful way to treat a patient.
From the moment that the patient walks through the door, we want them to have a nice, comfortable, relaxing experience. We just like for everybody to be nice and relaxed. We understand that a lot of our patients have a lot of phobias, anxiety about coming to the dentist, so we try to make it as comfortable as we can for our patients.
We do a minimally invasive laser periodontal surgery that we've been doing for 7, 8 years now. We've gotten excellent results. There's no scalpel, no sutures, and it regenerates bone as part of the healing process. So unlike conventional periodontal surgery where you're cutting the gum tissue away, in this procedure you're basically regenerating the bone support under the gum tissue. Cone beam CT scan. This is a 3-dimensional CT scan. It's less than 1% of the radiation of a typical hospital CT scan, and this allows us to totally evaluate the bone structure available for implants, allows us to identify areas that we need to be concerned with. At some times we can use the CT scan and develop a guide that allows us to place the implants on the computer and then guide the implants in the mouth directly into a predetermined position. So this allows us to do an evaluation pre-surgically that historically nobody's been able to do. With the CT scan, you know exactly what you're getting into beforehand. It's just a wonderful, wonderful device. We use it also to evaluate in 3 dimensions the temporomandibular joint. We do an airway evaluation. We do a sinus evaluation. There's just a tremendous amount of information in it.
I mean, a smile is, for someone to be able to smile again after they haven't smiled in so many years because they're ashamed of their teeth, or they feel that they're unhealthy, or they're in pain, and then to give that patient back the ability to smile and that they're proud of their smile, that's just, the best gift that you could give someone.